Welcome to Data Chats, a Metopio podcast where we talk about turning community data into real world action. Each episode, we explore how leaders across public health, hospitals, and policy use data to understand their communities, shape priorities, and drive change. Let's dive in. Hi, Heather.
Hi, Annie.
Today, I'm excited to talk about financial well-being. Our data team recently has curated a number of topics related to financial well-being. And I think a lot of times when we talk about data, we sort of tend toward this, where are people not making ends meet? Where are the high poverty areas? And that's fine. But I'd also like to talk a little more about how are people going beyond just surviving? Like, where are people thriving? And then what is preventing people from doing that beyond just the classics of childcare and food and things like that and rent. So let's start with average credit score. And I think this is a good one to pull up to begin with because it's really a kind of a topic looking at baseline financial stability. Where do people have the power to get loans? Where do people have credit? And not surprisingly, we have very pronounced regional differences on this.
Yep. And this does reflect, as you were saying, a lot of areas that are high poverty. But I think you're right. This gives us a little nuance and a little more depth to how that plays out in someone's life. Like you say, can they get a car loan? Can they get a credit card?
Mm-hmm. So obviously, lower credit scores here in these southern states. I do want to point out on this indicator that these are from the Opportunity Atlas. If we go to our data source, we can see it's from Opportunity Atlas. And I know this is one of these data sets that you love. So maybe you can give an overview of that.
So this one is unique because it was a really massive project that included data from the census, data from IRS, really tracking where people grew up. And they had a cohort, and I'm going to get the years wrong, but around the early
It's in there.
80s. Oh, perfect.
Mm-hmm.
This is why we have the notes.
Here it is, 1978.
Yep, I was right. 1978 to
85. Yeah,
1985.
you were.
Yep. And so kids who were growing up in these counties during that time, who then, wherever they ended up, the data that this project follows really tracked, where you grew up, but then where you were at the age of 27 or the age of, just around there. And 27 is where they start counting sort of stable adult. I think I was a stable adult at 27. But, what is your credit score as a young adult compared to where you grew up? And so where you're pointing there looks like Louisiana and into
Mississippi.
Yep.
Right.
Some very low credit scores for the kids who grew up. And actually that white streak, if you go back to the left, straight up.
Mm-hmm.
If I'm not mistaken, that is the Mississippi River.
Oh,
yeah. And so that's going to include the Mississippi Delta, which is a particular area of fairly high poverty, but also segregation that has gone back hundreds of years. So an interesting pattern that just that line pops up frequently in some of these measures. But
great. I love that you pointed that out. Yeah. And I think you're speaking a little bit too to generational wealth.
Absolutely.
And people from these areas don't have the generational wealth in place. So when a crisis strikes, what happens?
Do you call? Like you can't call
there's
your mom.
No one to call. Your social support system doesn't have the money any more than you do. And so actually I think let's switch out to a different topic, something like maybe debt delinquency. So then we start to see it's easy to accrue debt. And let's look closely at this. We're looking at people who are 90 days or more late on their debt payments. So these people in the southern states, the same ones who had, what were we just looking at? Low average credit score, also tend to have higher debt delinquency.
And those go hand in hand, obviously.
Yeah.
But yeah.
Yeah,
but to the same effect. Yeah. Where now you're at risk of losing any credit you did have, not being able to get more, and potentially paying a lot more when you do get credit. So a lot more cost to the same borrowing.
Hmm.
higher interest rates.
I think also, so related to that, the higher interest rates, the ability to get credit is credit card balance. This is a great topic to pull up too. Um, and I love how this is an inverse of what we just saw,
Hmm.
which at first glance may be a bit counterintuitive, but it's really not. We're looking at inability to get credit. These people are carrying a lower credit card balance in these southern counties because
Hmm.
maybe they don't have
Potentially,
access
yeah,
to the credit. Maybe they're using things like payday loans instead because they simply don't have that credit score to get a credit card, or maybe they can get a credit card, but not these the higher credit limits that people elsewhere can get, like up here in North
exactly.
Dakota, um, these border counties.
Hmm.
Um,
It also kind of suggests that in the other areas where you do have access to the credit, that people use it. People use it, and that sounds like, too much shopping, but people use it for a lot of things that perhaps everybody needed. They could be using that for, paying bills, paying for things that they really need and that they have access to because they have credit, because they have that flexibility to meet that need when it comes up.
right. I agree. And that speaks to the fact that um, it's not necessarily overspending,
Right.
that credit card delinquency or loan delinquency is not always overspending, and a lot of times it's just it's a crisis.
You want to do median debt and collections?
Let's do that one. Yeah,
Because that goes along with that debt delinquency rather well. So same,
there we go.
and it's a little sparse, but
Nice.
the same collections process, but how much is actually owed. And
Hmm.
if you look at those lower
Let's
numbers in some places,
Yeah, and we could even do a rank table. Let's do that.
that's a
Change
good
to
one.
ranking table, and we'll just look at how much is owed. Okay.
There.
So sometimes it's very little,
Yeah.
right?
This is someone
It's
who in the last 90 days could not get $1,000 together.
hmm And that is a lot of counties if we start to scroll down here. There's another topic here related to this. Oh, your your savings, something like that
That's a
that
good
we
one.
have.
Yep.
Households with emergency savings. Let's look at that. But I think we also have a topic with average emergency savings, which may
Hmm.
be even better. But also this, we can just see this pattern of Minnesota, North Dakota. Most of the households have emergency
82%.
savings. They're
Yeah.
stable.
That emergency savings is defined as $2,000 or more.
It is.
Yeah.
So that, right, that's why I was pulling
Yeah.
it into the other topic, because these people don't have $2,000 to
Right.
pay off these
Exactly.
delinquent loans. Uh-huh.
Exactly. And
Uh,
although loan delinquency has a specific exclusion for medical debt, that does sort of,
500.
yeah, it has to be at least 500 to
Hmm.
count. Um,
Hmm.
that does sort of still, tell you how much is available, like generally available. If you don't have $1,000 to pay off whatever debt it was you have, you probably don't have it for a medical crisis. It's
Hmm.
it's not that you're sitting around not wondering, not knowing what to spend it on. It's
Right.
not there, and it's not there for any purpose.
Yeah. A medical crisis or a car um,
Car
repair or
repair.
something like
Yep.
that. Um, I love this Minnesota. I like how this stands out as emergency savings, and it related to financial stability. I like this workers with employer-based retirement plans.
Hmm.
Minnesota also really stands out for that. Um, and I think that contributes. I think it ties in here.
Oh yeah.
For this indicator, we have states and cities and towns, but not county level, but it's still useful. In Minnesota, we have
Hmm.
3M, Mayo Clinic, lots of big employers who provide
Yep.
retirement.
And that speaks to what kind of jobs are available and what kind of jobs people are able to get. to
Hmm.
say you're not just working, you're not just employed, but you're employed at a place that has benefits.
Right. And very low in Louisiana and Mississippi, where we were just looking at those other indicators of financial stability, just don't
Mhm.
exist down here. So
Yeah.
that all ties in.
Yeah.
Um,
So we're now painting sort of a picture of a bigger system of not just how much people spend and how much they have in savings, but what resources they have to improve their situation. Their job is, potentially one without benefits. Their income is such that they can't pay off a relatively small debt in collections, a couple $1,000s. And I say relatively small as a person who would not, you know, is not in that situation. But if you don't have it, it's not small.
mhm.
But can't get themselves out of debt, can't get more credit, can't use
Don't have the
credit
credit.
to pay for the things they need, and you get stuck in this cycle that is, you know,
And don't have the family or social support
right,
needed in these kind of emergencies if
right,
that's, okay, so
the
that
generational wealth.
actually, let's pull up median net worth.
Hmm.
One more, because this also ties into the generational wealth and the inability to get credit.
Yep.
um, Again, we have states. Let's look at cities and towns, and maybe cities and towns in California. If there's an area you want me to zoom in on, I'm certainly happy to, but I just wanted to kind of pull up this indicator,
Hmm.
the generational wealth, and you're not going to see these values, median net worth, in those southern states we just looked at, right? This
Yeah.
is where people are making it. They're able to pay off loans. They're able to do things
They have
with their
equity in their
money to
houses.
grow money. Yeah.
Yeah. So this ties up home ownership, but home ownership in an area where property values are quite high,
Hmm.
but you have a population who can afford that. And you
Yeah.
can see the stark difference between Los Angeles proper and the towns and cities around it. Thanks for listening to Data Chats. If you found this episode helpful, subscribe to get future episodes delivered straight to your inbox. And if you want to explore the data we talked about today, visit metopio.com to see how we help public health departments and hospitals turn insights into action. See you next time.